Most people imagine a home medical setup as something complicated, expensive equipment, professional training, cabinets full of supplies. But in reality, most household medical situations are surprisingly basic. A fever at night, a minor injury, a sudden headache, a nosebleed, a stomach virus, a family member feeling weak or dehydrated. And when those situations happen, the biggest problem usually isn't the condition itself. It's disorganization. People know they own supplies somewhere in the house, but they can't find them quickly. The thermometer has dead batteries. The bandages are scattered across different drawers. The flashlight disappeared months ago. The medication expired years ago. And suddenly, a manageable situation feels chaotic. That's why the purpose of a home medical setup is not to turn your house into a clinic. It's to reduce confusion during stressful moments. Because when people are anxious, even simple problems become harder to manage. Think about what happens during a small emergency. Someone gets cut. A child develops a fever. A family member becomes dizzy late at night. Nobody wants to search the entire house looking for supplies while trying to stay calm. The real value of preparation is not perfection. It's accessibility. A basic home medical setup should help you do three things: assess the situation, handle minor problems safely, and stabilize conditions long enough to decide whether professional care is needed. That's it. Most people overcomplicate the process because they focus on advanced medical tools instead of practical usefulness. In reality, a well-organized setup often matters more than owning expensive equipment. Start with monitoring tools. A thermometer is one of the most useful items in any home setup because it gives objective information instead of guesswork. A basic blood pressure monitor can also be useful, especially in households with older adults or people managing chronic conditions. A flashlight matters more than people realize, particularly during power outages or nighttime emergencies. Then there are basic wound care supplies: bandages, sterile gauze, medical tape, antiseptic solution, disposable gloves. Simple items that handle the majority of small household injuries. The goal is not advanced treatment. It's preventing small issues from becoming larger ones. Medication organization is another major problem people underestimate. Many homes contain expired medications, duplicate products, unlabeled bottles, or scattered supplies stored in multiple rooms. That creates uncertainty during moments when clarity matters most. A better approach is creating one clearly organized location for essential items: pain relievers, allergy medication, any prescription medications that require quick access, hydration supplies, a written list of emergency contacts, and most importantly, expiration dates checked regularly. The real issue isn't usually lack of supplies. It's lack of structure. There's also a psychological benefit to preparation that people rarely discuss. When you know where things are, stressful situations feel more manageable. You think more clearly. You react more calmly. And that alone improves decision-making. But there's an important distinction here. A home medical setup is not a substitute for professional medical care. It does not replace emergency services, diagnosis, or treatment. Its purpose is preparation and stabilization. That mindset matters because many people swing between two extremes. Either they are completely unprepared, or they try to build overly complex medical kits filled with equipment they don't understand how to use. Neither approach is ideal. The most effective setups are usually simple, organized, and realistic, built around the problems people actually encounter: minor injuries, illness, temporary discomfort, unexpected situations late at night or during travel, and perhaps most importantly, communication. In stressful moments, people often forget critical information. That's why having written emergency contacts, medication lists, allergies, and important medical details in one accessible place can matter just as much as physical supplies, especially for households with children, older adults, or chronic medical conditions. The real issue isn't building a miniature hospital at home. It's reducing chaos when something unexpected happens. Because preparation changes how people respond under pressure. Not by eliminating emergencies, but by creating enough structure to think clearly when it matters most. If you'd like a structured breakdown of practical items many people include in a basic home medical setup, and how to organize them realistically, there's a practical guide linked in the description. And if you value educational videos that focus on calm, practical preparedness instead of fear, consider subscribing. Sometimes preparation is less about equipment and more about reducing uncertainty.